friends, this is Dr. Abdequaem Chimthanawala. I'll be sharing today two short cases which came to me where I prescribed a remedy which I sporadically or very rarely prescribe in those conditions. One condition which is very common for that remedy to prescribe, and one condition which I prescribed the first time in my life. Let me share two cases with you. This case which came to me first was for stomach disorder, and he told me that he suffers from nausea, continuous nausea, which he is not able to get rid of in spite of taking a lot of medicines. Till the time it takes, he feels better. Again, he feels the same symptom and the medicine is stopped. The symptom was only nausea. So that I told him, what is the problem? Any other problem apart from nausea? He said, no sir, only nausea. And when I asked the history, how did it start and all, he was not able to tell me anything. He told me, sir, I had gone somewhere, I had eaten food, rich food, maybe that is the cause, or maybe I had gone out of my hometown and had a food, maybe that from there I contacted. He was not able to judge how did it start. That's why a lot of doctors he showed and they failed because they thought it may be because of an error in diet, and the patient also thought that it might be because of that. So I asked him what exactly happens with nausea, and he gave me the common answer. They said there is nausea, then I feel like vomiting, then I vomit sometimes I don't feel like to eat, and there is something sensation in the chest and all, in the throat also sometimes. I said, what in the throat? He said, whenever there is nausea, I have burning in the throat. Then I asked him whether he was suffering from some reflex symptom, that is GERD symptom. He said, no sir, I don't have any that symptoms that khana upar aata, but whenever I have nausea, I have burning in the throat. So I was able to maybe sometimes define the symptom that in this case I have to have a drug where the patient is suffering from nausea and at that time he has burning in the throat. I said, anything else? Anytime have you taken any other medicines, any other allopathy medicine? He said, yes sir. About a few months back, 3-4 months back, I had severe itching in my body. Pitta I said, yes. At that time I had taken one antihistaminic. He had taken doctor, and that went off. Like सिर्फ वो एक ही दिन का था, चले गया. वो मैं कुछ खा लिया, इसलिए आ गया हूँ. डॉक्टर ने बोला वो ठीक हो गया. I said, फिर ये nausea कब शुरू हुआ? नहीं सर, उस टाइम तक ठीक था. He said that time it was okay. I think after maybe 10-15 days, I don't remember, then this nausea symptom started, but it had nothing to do with that itching was maybe because of some diet problem, and it was over. It was cured in one day only. And now when I started to make the link, I thought maybe because of that suppressed eruptions he had some problem. So I asked him, what exactly happened after you took that medicines of antihistaminic to suppress the itching? He said that was okay. Then after 10-15 days I had some symptoms of vomiting because I had eaten something, and then I took some medicine vomiting, and that also better, and now I have nausea. And gradually I started making that link. Maybe vomiting was because of suppressed skin eruptions or urticaria. Then he had nausea with burning in throat. Then I said, how is your stools? I said, sir, stools are also very bad. In stool there is large quantity of mucus. I passed a lot of mucus in my stools. Rest everything is okay, he said, sir. So in my case taking, I had only these 3 symptoms to prescribe, which I thought after the interpreting the patient's symptom, that was vomiting from suppressed urticaria, nausea with burning in throat, and diarrhea with lot of mucus in stools. And then, my friends, when I repertorized this case, the drug that came also surprised me, and the drug that came after repertorization was Urtica Urens. Urtica Urens. Urtica Urens, which normally I had prescribed lot of times in urticaria. So Urtica Urens 200, 2 doses I gave him at interval of 1 week, 7 days. For the first week he said everything is better, but still it is there. And after I repeated it in the second week, he came after 10 days and he says, डॉक्टर साहब नौशा गायब, बीच में एक बार उल्टी सामान हुआ था, वो भी ठीक हो गया, और कभी कभी खुजली आती है, sometimes I was itching and that is also much better now, and I have not taken any allopathic medicine. He was specific telling, you have told me, no, if you have itching, don't take any medicines. So I have not taken any allopathic medicine, but it is my immunity has grown now. Itching has automatically gone. I don't have to take any medicines. I am a strong person. So my friends, actually he may be a strong person, but this is what we call Herring's law of cure. Disease cured in the reverse order of appearance. He had urticaria, he had vomiting, and now he had nausea. All the 3 symptoms the patient was telling in a mathematical way after 15 days of taking Urtica Urens 200. So my friends, this is Urtica Urens. 2 doses at an interval of 7 days, and it cured his nausea. A simple disease, but a very important drug to learn. Now let me add a case of urticaria. This was a case, the patient came to me and he said, doctor sir, I have lot of itching in the body and बड़े ददोड़े समान आता है, wheals and papules, and it is more when I am in a warm room, when the fans are closed. It happens more when I am walking fast, whenever there is heat in the body. So he was telling, actually whenever there is warmth, the itching eruptions come. Then I asked him, it is continuous? He said, no sir, it is not continuous. जब भी गर्मी चालू होती है, whenever summer starts, I have this eruption, especially around Holi time. It is basically the season of March. So this was also a very specific symptom the patient had told me. I said something, if it is aggression from warm, so you feel better when you have a bath, or you feel better whenever the AC is on, whether the climate is cold. No sir, I have itching after bathing also. And he was very precise in telling, I have itching after bathing also. And now itching urtica eruptions after bathing, there are about 7 to 8 drugs which I remember. The first is Bovista, Calcarea Phos, Lachesis, Phosphorus, Pulsatilla, Sepia, Sulfur. Because this is a very peculiar symptom, itching urtica eruptions after bathing. And this symptom is confirmed in all these 7 to 8 drugs. I said something more about your itching and urticaria. He said, sir, but I don't want to suffer this every year, the same problem. I have to take allopathic medicine, it is better, then it goes, it comes back again. I want to cure this. I said, anything more? Because sir, I have only one problem, that I have to take 1 dose of deworming every year because I have worm problem also. So this was the acute case taking I did. And now if you repetize also, you will get this drug, that is itching eruptions urticaria yearly in the same season. The patient referred to Holi, that is in March. Itching eruptions urticaria aggravation from warmth. Itching urticaria eruptions aggravation bathing after. And itching urticaria eruptions with worms, either Ascaris or pinworm, that is written in our Mater Medica. Again, a very important drug, Urtica Urens, I gave 1 ml. I gave him 3 doses. The 2 doses on the first day, and after 1 week 1 dose. And the patient came after the 4th week. Definitely all the symptom improved, and I told him specifically come next year also, so that I can know that it is not repeated. And the patient came next year also at that same time, and he had no problems of itching urticaria. So this is what I learned about Urtica Urens. I would like to add 1 or 2 symptoms which I have seen in Urtica urens, and very important to remember, and that is urticaria alternating with rheumatism. If a patient of rheumatism comes and it is alternating with urticaria, you must remember Urtica urens. And second drug and the second symptom is milk in non-pregnant woman. I had an important case of a lady who had a high prolactin. She was taking allopathic medicine, but till the time she was taking, she was better. Once she stopped, back to square one. So Urtica urens is also a very important drug for milk in non-pregnant woman. You must remember few drugs with this symptom, that is asafoetida, cyclamen, Merxol, pulsatilla, tuberculum, which I have seen in practice. So two symptoms which are rare, you have to remember in Urtica urens, that is milk in non-pregnant women and urticaria alternating with rheumatism. So this is, my friends, in short about Urtica urens. If you like this video, please do share and subscribe. Thank you.